I need this treatment, but can I afford it? It's a question that many health consumers are unfortunately compelled to ask. Hello, and welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, senior writer in AHA's Washington office. Today our subject is affordability, a top issue for every American, and also for Brian Gragnolati, 2019 chairman of the AHA Board of Trustees. Brian is president and CEO of Atlantic Health System. Based in Morristown, New Jersey, the organization employs 16,500 team members and 4,800 affiliated physicians dedicated to building healthier communities. On January 15th, Brian participated in an hour-long webinar on affordability hosted by The Value Initiative, created by AHA in 2017 to serve as a thought leader for members on the critical importance of containing costs and providing top value. The webinar was hosted by Maryjane Wurth, AHA's Executive Vice President and Chief Operating Officer. This podcast captures highlights from their discussion.
Brian, let me start with you. As we look to the future of healthcare, how do we go about making healthcare more affordable and of higher value?
We do have an affordability problem in this country. Employers are really feeling a crunch right now, and I see it in our own organization. We insure about 25,000 of our team members and their dependents. And I hear that from employers each and every day. And then individuals are finding out that we have a real problem. And throughout the country, I see people who are making choices about whether or not they're going to pay utility bills or if they're going to pay their health care bills. Because I think we're finally at a point in this country where individuals have a lot of financial exposure.
Brian noted that the very structure of how healthcare is financed and delivered today has not kept pace with changes in the field.
When we step back and think about how this system was put together, the financing system of healthcare, I don't think anybody would design it the way it's designed today. It's been pieced together in a variety of ways, but it's hard to move back, and there's been many attempts to do that. But I think the recent work that's been going on, that's been stimulated through the ACA, allows us to begin to experiment with techniques that are working in a variety of settings. And I know that here at the Atlantic Health System, experiments that we're undertaking, like our accountable care organizations, patient-centered medical homes, bundles, have really taught us a lot. It's taught us how to use technology and data differently, and it's talked about how do we really face consumers in a different way. But the real dilemma and the pivot that we need to make causes a lot of disruption in our existing business models. You know, we have a business model that is predicated on volume. Even at the Atlantic Health System here in New Jersey, while we've really leaned into value-based payments, over 95% of our payments are still fee-for-service. So we really can't pivot on a dime here and move everything to risk. We've got to figure out a way to create glide paths. And really that's part of the conversations that we're having in this as well as other settings about how do we work as an association to make sure that our members are supported as we go through this transition. And the thing that I have learned most vividly as I travel through the country and talk to different leaders and healthcare organizations is every market is different.
I'm wondering if you could talk more about what we might do to address these rising healthcare costs and ultimately make care more valuable.
You know, when I was talking a little bit about recognizing that we have a problem, that conversation needs to occur at the governance level, because ultimately in our hospitals and health systems throughout this country, we have boards, particularly in the not-for-profit side of this, that really are the stewards of the care in the community. And I think getting your boards understanding that it's more about the care in the community and access to care than it's about the buildings is an important part of this journey. But probably the most important thing we did was start to count differently. So instead of leading with how many hospitals do we have, or how many ED visits do we have, or how many admissions, I asked our team here to say, I asked them, how many individuals did we have an opportunity to touch last year? And I got that cocked head look, like, well, we don't count that. We can tell you visits. And I said, no, how many unique individuals did we have an opportunity to touch? And our market, to give you an example, is 4.9 million people. Well, about 6 months later, after a lot of work, we came back with a number, and we said, we touched 780,000 of those 4.9 million people. I thought, great. What percentage of the care did they receive within our system? The answer was 3 years ago, it was about 36%. And today that number is closer to 60. So part of the work that we're doing now, as we are working hard to take out unnecessary utilization and push care into lower care settings, is we're trying to touch more people through a variety of mechanisms, but we're also retaining more care within the organization. And consequently, that has left our aggregate level of activities the same, and it's had a positive financial impact on us.
Near the end, the discussion opened for questions. One listener asked Brian what he hoped to accomplish during his tenure as chairman of the AHA and what made him hopeful.
One of the things that I am very hopeful about is that I'm seeing a mobilization around three important initiatives, not just in our field, but in communities. The first is access, and it's access to not just care, but it's also access to insurance. And we're going to continue to work real hard to make sure that that is available to everyone in this country. The second thing that we've spent a lot of time talking about is the issue of affordability. And I think, as I look at the time I've spent on the AHA board and moving into this role, hopefully we can really mobilize the field around that issue of responsibility, around that issue of affordability, and our responsibility as being an important catalyst in that effort. Because healthcare is scary, right? And we've done a lot as healthcare providers to try to take the scare out of the diagnosis, to try to be more available and accessible. But the new scare in healthcare is, can I afford the treatment? Can I afford the medication? And we've got to work as hard on that issue as we work on our clinical issues. And then the third is, we've got to have different voices at the table. Drug companies and healthcare systems need to have different conversations. Healthcare systems and those who pay for healthcare, insurers who act as an intermediary, need to work in different ways. And then healthcare systems and physician groups need to collaborate more around the care of communities, because there is plenty of money in the healthcare system. There's plenty of opportunities to do things together to reduce waste. And hopefully I'm able to play a little bit of a role in that in terms of really getting the field to feel supported and mobilized as we move forward in that. But make no mistake, I am very enthusiastic about the work that we're doing and the importance of that work to communities.
The webinar also presented the results of 4 online polls. In those polls, listeners identified consumerism as the biggest disruptor to the healthcare field and telemedicine as the technology that will have the greatest impact. Thanks for listening. This has been Advancing Health, a podcast brought to you by the American Hospital Association.